Hi guys. Today, we're diving into an important topic: Rett Syndrome. This is a rare neurological disorder that primarily affects girls and significantly impacts their ability to communicate, use their hands, and develop motor skills. In this video, we'll explore what Rett Syndrome is, its symptoms, causes, challenges faced by families, and most importantly, how we can support individuals with Rett Syndrome in educational settings. So everyone, let's get started. Rett Syndrome is unique because children appear to develop normally for the first 6 to 18 months. Parents often describe this stage as typical. However, after this period, they begin to lose motor and communication skills, and parents may notice sudden changes in behavior. One of the most notable symptoms of Rett Syndrome is the loss of purposeful hand skills. This means that children who were once able to grasp objects, hold toys, or feed themselves may suddenly struggle with these basic motor functions. Parents often recall a time when their child could pick up a favorite toy, hold a spoon during mealtime, or even reach for their caregiver, only to see these skills slowly fade away. As this ability diminishes, children with Rett Syndrome tend to develop involuntary hand movements that are repetitive in nature. These repetitive hand movements can take different forms, such as constant ringing, tapping, or clapping of the hands, and is one of the hallmark signs of the disorder. Unlike typical hand movements, which are intentional and controlled, these repetitive motions occur even when the child isn't actively trying to use their hands. For example, a child may appear to be clapping their hands continuously without being aware of it, or they may repeatedly rub their fingers together in a way that makes it difficult to use their hands for other tasks. Because of this, simple daily activities such as picking up a crayon to draw, holding a cup to drink, or even pressing buttons on a toy become incredibly challenging. Another major challenge for individuals with Rett Syndrome is difficulty with speech and coordination. Many children with this condition eventually become nonverbal, meaning they lose their ability to speak words aloud. However, this does not mean they don't understand what is being said to them. In fact, many individuals with Rett Syndrome have a good understanding of language but lack the ability to physically express themselves through words. Imagine wanting to communicate something important, like being hungry, feeling cold, or simply wanting to say "I love you," but being unable to form the words. It can be incredibly frustrating for both the child and their caregivers. This is why alternative communication methods, such as eye-tracking devices, picture boards, and sign language, become crucial tools in helping them express their thoughts, needs, and emotions. In addition to these challenges, many children with Rett Syndrome also experience breathing irregularities, seizures, and scoliosis. Breathing irregularities can take many forms. Some children may frequently hold their breath for long periods, while others may hyperventilate, taking in short, rapid breaths without realizing it. These breathing disruptions can occur unexpectedly throughout the day and can sometimes interfere with sleep, eating, or moments of relaxation. Parents often describe how difficult it is to watch their child struggle with unpredictable breathing patterns, as it can sometimes lead to anxiety or discomfort. Seizures are another common symptom of Rett Syndrome, affecting a significant percentage of individuals with the disorder. These seizures vary in intensity, ranging from mild episodes to more severe, prolonged convulsions that require medical intervention. Because of this, many children need to take medications to manage their seizures, and regular monitoring by a neurologist is often necessary. In some cases, seizures can be unpredictable, making it essential for caregivers and educators to be prepared in case of an emergency. This is why many parents, teachers, and support staff undergo seizure response training to ensure that they can provide immediate assistance when needed. Lastly, scoliosis, or a curvature of the spine, is another physical complication that commonly develops as children with Rett Syndrome grow older. Since many individuals have difficulty maintaining proper muscle control, their spinal alignment may begin to shift over time, leading to posture problems, discomfort, and in some cases, the need for medical braces or surgery. Physical therapy is often recommended to help manage scoliosis symptoms, along with regular checkups to track any changes in spinal curvature. As you can see, the symptoms of Rett syndrome are complex and can greatly impact daily life. However, with the right support systems in place, such as therapies, adaptive communication tools, and medical interventions, individuals with Rett syndrome can still engage with the world around them in meaningful ways. Understanding these symptoms is the first step in providing better care, education, and resources for those affected by this disorder. Diagnosing Rett syndrome can be complex because it shares symptoms with other neurological disorders such as autism or cerebral palsy. However, there are specific markers that help with early identification. Doctors rely on clinical observations, genetic testing, and medical history analysis to confirm the presence of MECP2 gene mutations, which are responsible for the disorder. Genetic testing is crucial because Rett syndrome is often misdiagnosed as autism or a general developmental delay. Early and accurate diagnosis is crucial for intervention and support. The earlier a child receives therapies and accommodations, the better their quality of life will be. So, what causes Rett syndrome? Research shows that mutations in the MECP2 gene disrupt brain development, leading to the symptoms we discussed earlier. But what does this really mean? As mentioned earlier, the MECP2 gene is responsible for producing a protein that helps regulate brain function. When this gene is mutated, brain cells don't function properly, leading to the developmental regression seen in Rett syndrome. This disorder primarily affects girls, occurring in about 1 in every 10,000 to 15,000 female births worldwide. It is much rarer in boys, but when it does occur in males, the symptoms tend to be more severe due to differences in genetic makeup. Although the mutation happens randomly and is not typically inherited, researchers are actively studying ways to intervene at the genetic level. While there is no cure yet, the future holds promise for potential treatments. Living with Rett syndrome presents many challenges for both individuals and their families. One of the biggest hurdles is communication. Since many children cannot speak, they rely on alternative methods such as eye-tracking devices or communication boards. Individuals with Rett syndrome face progressive mobility challenges, often requiring wheelchairs or braces as motor skills decline. Feeding difficulties, including trouble swallowing or chewing, may necessitate feeding tubes for proper nutrition. Lifelong medical care is essential for managing seizures, orthopedic issues, and respiratory concerns through regular specialist visits. Additionally, families experience significant emotional and financial strain, as caregiving demands can disrupt work and stability, making support networks crucial. Children with Rett syndrome may not speak, but they are still capable of learning in their own way. Since traditional teaching methods may not work, educators use alternative ways for them to participate, like assistive technology and eye gaze tools. Every child's cognitive abilities are different. Some understand a lot, while others need more structured support. With the right approach and personalized strategies, these children can thrive and reach their potential. There is currently no definitive cure for Rett syndrome, but there is hope. The FDA has approved DAYBUE trofinetide as the first treatment for Rett syndrome in adults and children aged 2 and older. While it doesn't cure the condition, it helps manage symptoms and improve quality of life. DAYBUE is taken orally or through a gastrostomy tube, with the dosage based on patient weight. It's given twice daily, in the morning and evening, with or without food. In addition to medication, various therapies play a crucial role in helping individuals with Rett syndrome develop skills and maintain their abilities. Physical therapy helps with mobility and reduces joint stiffness, while speech therapy uses augmentative and alternative communication devices to help children express themselves. Occupational therapy focuses on everyday tasks like dressing and eating, and music and sensory therapy enhance engagement and cognitive development. Although Rett syndrome presents lifelong challenges, these therapies, combined with new medical advancements like DAYBUE, offer hope for improving daily life, building confidence, and maximizing each individual's potential. Educators play an essential role in supporting children with Rett syndrome by creating a classroom environment that is both inclusive and adaptive to their unique needs. Since verbal communication is often limited, One of the most effective ways to support these students is through assistive technology, such as eye-tracking devices. These devices allow children to express themselves by selecting words, images, or commands using their eye movements. This technology helps bridge the communication gap, giving children a way to engage with teachers and peers, answer questions, and participate in learning activities. Without such tools, many children with Rett syndrome might struggle to express their thoughts, but with the right support, they can communicate and take an active role in their education. In addition to technology, visual supports are incredibly beneficial. Many children with Rett syndrome respond well to picture cards, communication boards, and other visual cues that help them understand daily routines, follow instructions, and make choices. For example, instead of asking a child verbally what activity they want to do next, an educator can provide a set of picture options that the child can point to or look at, making communication easier. These visual supports reduce frustration and help children feel more in control of their learning environment. They also promote independence, allowing students to communicate their needs and preferences without relying solely on adults. Another key strategy is breaking tasks into smaller, more manageable steps and incorporating frequent breaks. Rett syndrome affects motor skills and cognitive processing, so large or complex tasks can feel overwhelming. By simplifying instructions and allowing more time for completion, educators can help children stay engaged without feeling frustrated. For example, instead of asking a child to complete a full worksheet at once, breaking it down into 1 or 2 questions at a time can make learning more accessible. Frequent breaks also help prevent mental and physical fatigue, giving children the chance to reset and refocus before moving on to the next activity. Incorporating sensory activities is another powerful way to enhance engagement. Many children with Rett syndrome respond well to tactile, auditory, and movement-based experiences, as these activities stimulate their senses and keep them involved in learning. Activities such as playing with textured objects, listening to music, engaging in gentle movement exercises, or interacting with sensory bins can create an enjoyable learning experience. Sensory activities not only improve focus and engagement, but they can also help with cognitive and motor skill development. For example, a child might enjoy finger painting, which helps with fine motor skills, or listening to calming music, which can create a relaxed and focused environment. These activities provide a multi-sensory approach to learning, making lessons more accessible and enjoyable. Finally, fostering an inclusive classroom environment with peer support is incredibly valuable. Many children with Rett syndrome benefit from social interaction, and by encouraging classmates to interact and engage with them, educators can create a supportive and welcoming atmosphere. Rett syndrome presents many challenges, but with the right interventions, therapies, and educational strategies, individuals can still learn, communicate, and thrive. Support from families, educators, and therapists plays a crucial role in ensuring that children with Rett syndrome receive the resources and encouragement they need to reach their full potential. By using assistive technology, sensory activities, and inclusive teaching methods, we can help these children engage with the world around them in meaningful ways. Raising awareness and advocating for better support systems is essential in creating a world where every child, regardless of their abilities, has the opportunity to learn, connect, and grow. By working together, we can make classrooms and communities more inclusive, supportive, and accessible for individuals with Rett syndrome. Thank you for watching, and I hope this video has given you a deeper understanding of Rett syndrome and the importance of providing the right support.